walk up there and then walk back here.
Okay, yeah, come this way. All right, Jade.
Come here,
So this is Jade. She's a 6-year-old mixed breed, and what we're seeing from her is a hunched back and a restricted gait in the hind limbs. This is several months duration. She's currently on muscle relaxers and anti-inflammatories, and this started when she was playing with a large German Shepherd, and they reared up, and he tipped her over onto her back, and this is when this started. So we see she's got this kind of almost as though she's pulling a load, walking with her hind legs under her. She doesn't lift the tail very high, and she's obviously got some hunching in the back.
Go.
So now we're doing chiropractic on Jade, and I have adjusted the right side of her pelvis, the right PI, and L4 and L1. T13. So we're definitely finding some things. She's not really painful. So what we're doing with chiropractic subluxations is we are releasing restrictions. I've got T7 here. So that we get better circulation.
Hey, what are they doing to you? You like it? Is it helping?
Hey, sweetheart, you keep laying down on me.
Okay, back up. Stand up.
Girl. She's got some muscle atrophy in these hind legs. I'm going to check her knees just because of how she moves, but they seem to be pretty solid.
Stand up, Jade.
I know, it's hard to keep standing
I
up,
know,
sweetheart.
baby.
You're doing great. All right, you'll let me have this leg up, won't you? When she sits always on that right hip and actually holds this left rear leg off the ground. She'll pick it up and just kind of let it hover. Good girl. So we're going to do the other side.
Good girl, Jade.
Just pause it.
Yeah.
So now we're checking the other side. Ooh, there's a little tender spot. So she's got L3, L2 side by side. And so those were a little tender. When I used my thermography machine on her, I did see circulatory restriction along her left paralumbar muscles. You're being a very good girl. She's getting a lot of adjustments.
That's way out.
T8 and L2 there. One more front leg speed.
Good girl.
Didn't find any adjustments needed in her neck or her occiput. All right, stay here.
Come on.
I'm gonna pause it. We'll take her out and walk around. Oh, there's a good shake. She got all the way down to her tail. We're going to kind of watch her, let her walk around a little bit. Here, Jake, wants more treats? Come here. Kind of seeing if we can loosen up some muscles. Pause it a second.
Here.
Yep. All right, let's see what you do, Jade.
Come on, sweetheart. Let's see your
So in
legs.
further evaluation, there is a clicking in that right knee, which may be a cartilage issue. She does not have cranial drawer sign on either knee, though. It's not really a crepitus, but there's a click to that knee. Come on, Jade. See how you're moving. I'm going to take her by me.
Come on.
She wants to come see me. So we have improved the extension on those hind legs a little bit. Go ahead and take her down towards the front desk and back, if you would.
Definitely
Yeah.
a waddle to her neck. Come on.
Kind of just walking her to let her stretch out a little bit.
Waddles.
She's got much better movement of the pelvis. She's not as stiff in the pelvis as she was. She is still a little bit hunched, but we did 6 or 7 adjustments in that spine, so there's going to be some muscle tightness in there still. Come on, Jade.
Jade, come on. Yeah, you smell other animals, hang on.
You should walk right past me. I want to get a sideways view here. The back has definitely flattened out, though. We can see that in the video.
Yeah, you're doing good.
Picking her head up a little bit more.
Good girl. Yeah.
So a little bit of improvement, and we will be going on with treatment of Jade to see what else we find. We have not yet done full physical. We're just starting with chiropractic today. But we're definitely getting extension of the hind limbs behind her pelvis now, which we were not earlier.
Come on, slugger, slugger.
So we'll keep you all posted on Jade's progress.